Welcome to the Alliance Lift, the monthly podcast that brings you closer to the people driving change in health policy and systems research around the globe. I'm your host today, Giulia Loffreda. In each episode, we explore the experiences of Alliance alumni, people who have worked with the Alliance over the years, making 3 stops along the way, learning from the past, living in the present, and leveling up for the future. Whether they're shaping policy in ministries, advancing research in universities, or, as in today's episode, championing community-driven solutions for non-communicable diseases, or NCDs, our alumni are challenging conventions and creating more equitable, resilient health systems. I'm happy to introduce our guest for this month's episode, Dr Archana Shrestha. Archana is a Nepali epidemiologist, researcher, and educator whose work is reshaping the way we think about prevention and implementation science in low and middle-income countries. She has spent over a decade designing and leading community-based health programs in Nepal, with a particular focus on non-communicable diseases. She currently directs public health programs at Kathmandu University and leads the Institute for Implementation Science and Health, where she's advancing applied research and capacity building across Nepal. Archana also co-leads major national efforts to strengthen research and training on cardiovascular diseases, and through the Alliance, she's leading an implementation research project. Archana, welcome, and thank you so much for joining us. It's only been a few months since we last saw each other in Cambodia. How have you been since then?
Yeah, thank you, Julia, for the warm introduction. I'm doing pretty well.
So now let's rewind a little. This is learning from the past. Archana, you began as a researcher in a complex and often under-resourced health system. What motivated you to move beyond purely clinical research and focus more on implementation science as a means of change?
So my motivation came out of my own experience. I did my PhD in epidemiology, looking at Nepali diet and non-communicable diseases such as hypertension, diabetes, and overweight. I did it in 2012-13, and we usually thought that, okay, it is the Western diet that is a reason for NCDs, and we consider traditional diet as healthy one. But when I looked at Nepali diet, like a pure traditional diet, and look at different factors or patterns within the diet, then I found very strong association between consumption of large portion sizes of rice with diabetes, hypertension, or overweight in my context, specifically with animal fat. So it was eye-opening. I was able to discover, or rather I'd say validate, because there is this known evidence that refined grains and animal fat are associated with NCD. It doesn't make sense to validate the known fact. We already know so much about it. Now it makes more sense to work to solve the problems that we have identified. My postdoc fellowship was creating an intervention with communities within workplaces and outside settings to create environment that provide healthy food, and we saw that it does affect the health of the communities and people in different settings. And I think that motivated me more to get into research that is implemented in real world setting and that is making real changes in the society or communities.
Great. And on that note, then, I would like to ask more about the work that you conduct with the Alliance. You're currently leading a project that's focusing on fostering with female community health volunteers to improve hypertension and diabetes care in Nepal. We have been working together since 2023. What has this journey been like for you?
So we have been developing the implementation strategies and testing to build capacity and providing support to female community health volunteers to deliver a group care model and empower hypertension patients very near to their home or at their home, whatever is possible, for managing their blood pressure. We started with research. I think something that stood out unanimously in a lot of our qualitative investigations and information sessions was there is not much connection between primary healthcare setting and community. So that piece was missing, which used to be a big strength in Nepal. So that motivated us to explore ideas that could be sustainable and replicable and scalable in context of Nepal. And we moved towards the idea of engaging female community health volunteers. Let me also tell you that this topic is very controversial. Many people still comment that FCSVs are illiterate because a lot of them were hired or recruited in the health system in 1980s, and a lot of them are still working in the same capacity. And many of them have limited mobility due to old age and delivering complicated things such as NCD care. But what I have learned working with them so far is, yes, there are challenges, but we cannot put all FCSVs in the same category. There are definitely some who are illiterate and face those kind of challenges. But even in our pilot work, we found that about 70% of FCSVs were able to deliver healthcare after training, which was a very huge motivation for us. And of course, there are variation between FCSVs within health facilities. And that's also something we are trying to capture from our own research. What are the contextual factors that affect their performances? So I think we will be able to throw more light into that after our research as well.
Thanks for mentioning the challenges of working with female community health volunteers, but also that the need to overcome those challenges. So what have you and your team learned from working with them? How is their role evolving? Can you expand a little bit more about their contribution for non-communicable diseases?
Okay. Yeah, so FCSVs have been credited a lot in bringing the infant mortality and maternal mortality down in Nepal. But when we face the challenge of non-communicable diseases, we don't have that level of community engagement and that level of trusted partners living with the patients or with the community who we can mobilize to deliver care. And FCSVs have been a great opportunity. We have been working with FCSVs for many years now, doing like preliminary work with them or qualitative focus groups and developing study materials, training them to deliver care, working with them day to day and supporting them to deliver care. I think one of the major challenges we face is to create a formal supervision and monitoring and mentoring connection with healthcare workers. Because as a researcher, we step in from outside, but they need that kind of support and that kind of connection within the health system. Another issue that also came up was, can they provide services to male? Because they have historically providing services to women and children. But in our research now, we are very confident it doesn't matter the gender of the recipients, they are able to provide the services. Another challenge I would say is, it's true that not all of the FCSVs can deliver the same quality of care. To approach that, we have also recruited their peer supporters, and we are testing that model and we are optimistic about it as well.
Thanks, Archana. And the research you are doing is so important because there are so many lessons for other countries who are also trying to engage community health workers. A couple of months ago, we had the chance to meet in Phnom Penh in Cambodia for the inception meeting for this new round of work where grantees from 8 countries, including yourself, came together to share the project, the challenges and the experiences. Besides the warm Cambodia hospitality and the endless mango that we have been eating, did anything from those conversations shift how we are thinking about implementation on your work in Nepal?
Thanks for reminding me of the food. It was really delicious.
It was.
Yeah, so it was great experience for sure. Being in Nepal, we collaborate with many external agencies and universities out of Nepal, but most of them are like US-based or UK-based or Australia-based. We really get a chance to collaborate within a region among each other. However, in Cambodia, we could strike a conversation within a minute and we would be discussing same challenges and same barriers. And we had different approaches for the solution of those similar kind of barriers. So I think as we move forward, I'm excited for ongoing conversation as well.
Let's fast forward to today. This is living in the present. So we discuss now a little bit about research, but I would like to ask you about your experience also with policymakers, with different stakeholders, because research is just one part of the picture, but also there is the translating the findings into policy and practice. How have you been engaging the policymakers or health planners in Nepal as part of your work? And particularly because the way also the Alliance, we see implementation research has to be conducted in an embedded way, so really closely in collaborations with the key stakeholders and including with policymakers.
Yeah, so this work actually has provided a great platform to connect directly with policymakers and program planners. I would also mention WHO Nepal has been very super supportive in fostering this relationship. So in terms of work, we are partnering directly with the communities, particularly the municipality government. So when we are delivering the program, we don't have our research staff. We are training their staff, so the healthcare workers who are working in the community within the primary healthcare system. So we train those human resources. We work with FCSVs who are again embedded within the health system in Nepal. So we are capitalizing those infrastructure in delivering the care and then continuously discussing with them what are the new barriers or unknown barriers and how do we improve the program. In a way, we are co-designing a problem-solving technique with the existing healthcare system. And then we also work very closely with the federal government and provincial government. We regularly engage them in planning process and review processes and send them our learnings. Many of them also visit to the study site and to discuss and engage and then see what is the implication of the current research and what are the opportunities for the future. So we are also continuously engaging in the conversation regarding like sustainability and replicability and scaling up prospects of this specific strategy. Of course, we need to learn a lot, but we are already talking, and no matter whether it's a success or a failure, we're going to do it together. So I think that has been a very core theme within this work.
To follow up on this, what are the challenges in working so closely with engaging the communities, engaging the municipalities, engaging the different stakeholders?
Within our research team, we always discuss this. So we need to invest as much time in building the partnership relationship with our stakeholders, community or health system, as much we invested in our data quality. So that's given if you are doing implementation science. So I don't know if we should call it a challenge because you have to do it as a part of the process. It's very challenging to collect the data as well, but we don't call it challenge. We call it part of the process. So I take it that way. When there was HPV vaccine ongoing, they were implementing the HPV vaccines. We had to almost pause most of the work because there was no time for other work. So it's just about learning as you go and documenting that.
I couldn't agree more. And that's also why I love implementation scientists. They have this culture of learning so embedded in their practices, but also knowing that research takes time and you need to build relationships, and that's as important as data collection. As some of our listeners will know, the fourth United Nations high-level meeting on NCDs will take place in September in New York. This high-level meeting will see countries adopt a new political declaration on non-communicable diseases. As someone who works so closely with communities that are affected by non-communicable diseases, what is one message that you would like to convey to world leaders that you think they are missing in order to turn commitments into action?
I would say investment. The primary healthcare system in LMIC setting, like Nepal, were mostly built in like 80s. And it was built to deal with infectious diseases, to provide immunization, like few number of doses within a year, or ANC care, like 9 months of care to a pregnant woman. It was not formed in a way to provide chronic care. But now we are talking about people with hypertension and diabetes. They are diagnosed in like 30s or 40s, and they need care their whole life. And then within the healthcare system or in these kinds of forums, we are saying, oh, we will utilize the same primary healthcare setting to provide this care delivery without thinking how much burden in terms of workload or resources or the commitment that is needed to make that into reality. So I would really urge leaders that they must acknowledge this shift and they must acknowledge that we need more investment in chronic care model. This means investing in human resource development or strengthening healthcare information system in a way that is supporting the chronic care, fostering genuine relations with community engagement, because now we need to engage with them throughout their life, or ensuring long-term access to quality care or essential medicine that they need. So without sustained investment, I don't think commitments can really convert into action.
Thanks, Archana. And let's look ahead now. This is Leveling Up. In your view, what does a health system that truly supports implementation science and community-based solutions will look like?
Implementation science is all about delivering evidence-based programs and then delivering it in a successful way. So for that, I would think the health system need to partner with communities and academic institutions to solve real-world problems, provide a formal platform maybe to discuss regularly about health issues and evidences and what solutions are needed. There is also huge resources out of the formal healthcare system that they can capitalize into. For example, universities can provide or offer expertise and human resources for delivering care or even like answering the problem. I feel like that kind of formal mechanism can really fuel implementation science in a very meaningful way. Another mechanism that needs to be built in is to engage communities. Like, how do we hear the voices of patients we are serving? Or how do we hear the voices of program planners who are planning to deliver care within a small community? And I think health system is it's pretty siloed. So being open to creativity and testing new research ideas, conducting embedded research within the healthcare delivery, partnering with the monitoring and evaluation, identifying new barriers, and at the same time, developing strategies to solve them together, and then to really know what works and what not, and then be brave to eliminate things that is not working in that context.
And what gives you hope right now?
Yeah. So, Julia, when I started working in non-communicable diseases, I think in 2010, when we started working in that area, and I used to come to Nepal and discuss about it, but nobody was talking about it. I felt like it was so alien topic at that time. But now the fact that people talk about it, I feel very optimistic. So we may not have perfect solutions to everything, but at least we have acknowledged that there is a problem. And I think that is most optimistic part of working in the field of NCD for me.
No, it must be quite exciting also to be part of that change and seeing how perhaps in the last 15 or 20 years the situation changed. So there is definitely hope for the future, but we need definitely to do more for NCDs and rethink the models of care and the way we approach non-communicable diseases, including research. Finally, I would like to ask, what advice would you give to young researchers in Nepal or beyond who want to work at the intersection of research, equity, and implementation?
I think being a researcher in public health, especially in implementation science field, is a big opportunity because it has a potential to make a very, very large impact. So to the young researchers, I would say your work will probably determine in the future who will live and who will live healthy lives and who will not live. So it is a very fertile land of innovation, and there is a huge opportunity to deliver impactful work. And then second thing I would say, whenever I meet young researchers, they are so interested in publishing. Papers are very lucrative for career growth and visibility. But I would really highlight that it's not the only thing. It should be the byproduct of the larger impact that you are planning to make a difference in the community. So I would want to make them cautious against that lucrative thing and focus more into a real impact that your research is going to create.
Thank you so much. It's been fascinating to talk with you. And your story is not only about research, it's about the relationships, relevance, and resilience. You have shown us what it means to listen to communities and to better integrate science into health system strengthening. Before we close, any reflections or final words for our listeners?
A lot of us are actually working or practicing or researching in silos, and we definitely need to break that. We need to build more connection with the people who we want to serve, and then get out of our checkboxes and build that trust and connection with the people and system. And it does take time, and I would say don't take it as a challenge, just take it as a part of your work, and I think that would make a real impact.
Thank you again, Archana, and thank you to our listeners for joining us on the Alliance Lift. If you enjoyed this episode, please share it with colleagues and friends working in health policy and systems research. You can also join the Alliance Alumni Network on LinkedIn to stay connected and hear more inspiring stories like this. Until next time, take care and keep doing the work that lifts others too.